So what happened to Deon Sanders' toes? In this video today, we're going to talk about that. What's up, guys? I'm Dr. Antonio Webb. I'm an orthopedic spine surgeon here in San Antonio, Texas. In this video, we're going to be reacting to Deon Sanders and his recent medical complications and procedures that he has recently underwent. You know, Deon Sanders is a legend in the NFL and also the National Baseball League, the MLB. He's been in the news lately because of his time at Jackson State and also his transition to Colorado State to be the head football coach. Well, there's been a lot of talks about his amputations that he had to have on his foot. And in this video, we're going to be watching a video and talking about some of the medical jargon that goes on. Like, what happened to his toes? Why did they have to amputate his toes? What type of complications that he had? And I'm gonna give my thoughts. Let's jump right into it.
Man, you love getting pampered.
I wish I was getting pampered. You know, pampered with 8 toes.
Man, what a big, oh.
You ain't no good. See, you ain't
No,
no
I
good.
just said,
You told me we was gonna be serious.
I thought you was magic or something. You was just hiding it.
Boy, look at
You
him.
like, dog, I can't be serious with you before about 5-10 minutes. I brought you something.
You're gonna kill me, but you're gonna bring.
You see the scars on this leg? Those are fasciotomy defects or incisions for a procedure that we do in orthopedics called fasciotomy. And a little bit later, I'll explain what that is.
Yeah.
Ooh,
I took care of you. I took care of you.
you always do.
Yeah,
I like this, dog. Because I know what it is. And I think I love the colors. Oh, Jesus. Oh, yes, Lord. Shay. A black and gold, dog.
Yeah. Only me and you got a pair of those.
You ain't no good, but sometimes you good.
Do I take care of my
You
dog?
do.
What do you get the person that has everything? More of everything.
It's a rough year last year.
Was that the big toe that you injured, that hurt, that really took?
I had 3 surgeries for that.
But it was a turf toe, wasn't it?
Turf toe, yeah. That's what started everything.
Yeah. My brother had that same injury. Had surgery, didn't do anything, couldn't do
It might be
anything.
the same. And they told me my foot has been dislocated for 18 years.
So you
Turf toe is just, you know, in a general description of it, it's just a sprain of the big toe. It's very common in athletes because you're bending that toe when you're on the line, or if you're a receiver or a, you know, offensive lineman. Bending down and putting a lot of force on that toe can injure that ligament. Once that ligament is injured, then that toe will stay in that position because it's deficient. There's no support on the bottom plantar surface of that foot to support that toe. So over time, that toe can be dislocated, and players just keep playing because they just want to play. He mentioned that he's had 2 or 3 previous surgeries. We're going to check out and see what led to the next step of that surgery.
do this every day.
2 or 3 times a day, I have to.
2 or 3 times a day?
Yeah, it starts hurting after a few hours. And I have to keep the blood circulating to get movement out of it.
So,
Like I could make it through like 3/4 of a game, then after that I'm on meds and everything. I'm limping. I got a little stroll at the beginning of the game. And about after 3rd quarter, I'm limping like crazy.
how long you got to live with this?
Forever.
You don't
I think it's my new normal. I'm down to like 7 pills a day.
Right.
I was like 30-some pills a day.
What?
Yeah.
The pain was that bad?
Just all, you know, I'm on blood thinners and
Right.
everything.
Oh, yeah. You
So I
use
get a
blood
little
thinners for
cut.
the rest of your life.
Oh my God, I get
Rest
a
of
little
your
cut,
life.
it's over. You know, it's the first time I really let people really
I know.
openly see this.
Let me ask you a question.
Yeah.
What about that 3rd toe? Did you think about that, like, you know, y'all going to straighten it out while you there?
No, it's just like that. They
I know,
gonna
but I'm saying,
straighten it
then
out.
you want to straighten out?
He chilling. He leaning over.
You know
He
what?
mad
You
because the
really-
homie's gone.
I mean, you probably weigh like a size 11, but you really 8 with that. If that toe straight, that'll have a size and a half, at least 2 with that toe.
Man, I love the humor and just him trying to make the best out of this situation. I mean, that's the best way to get through difficult situations, just to laugh, have fun, and just find humor and, you know, some of the lowest points of your life. That's what it's all about.
Straight.
Oh, really? No, honestly, I'm a 12 on this side and I'm 11 on this side.
So no more sandals for you, no flip flops for you, huh? Oh, my bad time. You know what I'm tired. You know what? Maybe they do a special
Put
flip
a
flop
straight
and put
face,
it
dog. Put a straight face. with a straight face, though. How you doing with a straight He ain't no good. He ain't no good. Who come to visit a man and
Man, Shannon Sharp is hilarious. I love watching this dude.
Because you know why? Because you already know if the shoe was on the other foot.
Why you have to say the shoe?
Oh, my bad. Boy,
He ain't no good, man.
that's one thing about my homeboy. He gonna be 8 toes down for you. I mean, like, what's the saying with a 10? Oh, he ride hard. He 8 down for you.
I'm glad you can't see you, boy, though.
Man, you know I had to get up here and
This
see
your
you.
old stomping ground right down the
It
street.
is right down the road, man.
You ran that.
The injury, not an injury, but you was in dire straits.
True.
You had a blood clot.
Clots.
Clots.
Yeah.
And I knew something was seriously wrong because we talked every single week.
Yeah.
And there were a couple of weeks that we didn't talk.
They took my phone.
And
So Deon Sanders was found to have blood clots in his leg, specifically the femoral artery that is a structure, it's an artery that supplies blood flow to your leg. If there is blockage of that artery by either a clot or some type of tumor or some type of mass, a vessel aneurysm that causes expansion that the blood flow can't get through, well, the area below that will lose blood supply and may die. So if you can't get the oxygen and nutrients to that part of the foot, that foot will die. And that's exactly what happened. He had a blood clot in the femoral artery. Blood flow could not get down to the most distal segment of that is the toes. And the vessels down there, not as big as the vessels in your leg. So it doesn't take a lot of obstruction or occlusion to cause vessel damage or in-organ damage, which is the end portion of your toes, undergo damage. And that's why a lot of diabetics and patients who have peripheral vascular disease, they lose their toes because of the limited amount of blood flow that goes to that area. Well, in his case, he developed compartment syndrome. Compartment syndrome is a condition where the muscles, the parts of your leg or your arm, whatever compartment that we're talking about, does not get blood flow or does not release the blood. So if blood builds up from a fracture, if someone hits your leg with a 18-pound brick and there's swelling, the blood flow can't get out, the blood can't get out, then it swells, it causes the muscles to die. And that's a urgent procedure for us as orthopedic surgeons. We have to do what's called a fasciotomy to release the pressure. And that's exactly what Deon Sanders had. He had this procedure, the fasciotomy. We make an incision on the outside of the ankle and also of the leg and also the inside, the medial and lateral, to release those compartments. Once those compartments are released, then the muscles can have room for expansion and to oxygenate and to get blood flow. So serious condition, this all led most likely from a family history of blood clots. Patients who have family histories of blood clots, they're more likely to have blood clots themselves. There's this so-called Virchow's triad that predisposes patients to having blood clots. And that's endothelial damage, that's from smoking, that's from hypertension, that's from some type of surgery, something that injures the endothelium of the vessels that causes it to be more susceptible to clotting. There's stasis, venous stasis. That's essentially where you have immobility. Like, let's say you're sitting there for 6 months, not moving your leg. You're more likely to develop a blood clot. The blood needs to be able to move throughout your body, and in order to do that, you have to be mobile. So that's why patients who are immobile, they're more likely to develop blood clots. And then there's the hypercoagulability. And this is anything that places you at high risk for developing blood clots. Smoking, diabetes, contraceptives. If you have any risk factors for having blood clots. And some patients have predisposition genetics to having blood clots, like factors, 5 latent deficiency or protein C deficiency, protein S. Those are risk factors for you having a blood clot.
I was like,
I woke up and I can't say high because I never smoked or drank in my life. So I woke up under the influence. And they say I was just texting. They're like, we're gonna take your phone. You put somebody there crazy.
Right.
So they took my phone, but you're right.
what was going through when they told you your diagnosis and you were in dire straits? They almost had to take not just the toe, but the foot, maybe even come up the leg.
No, it was, first it was the leg from knee down because I wasn't getting no blood.
Okay.
Then it was life.
Okay. Wow.
And then it was 2 toes.
Okay.
And I thank God that it got to 2 toes.
Right.
They take them.
So you like a slaughter now, 3 toe slaughter. My bad. No, you said we weren't joking. You said we no, my bad. My bad. I'm sorry.
See what I'm saying?
Those are 3 different and also really serious medical decisions that you really have to make. So if someone is not getting blood flow to a certain part of their body, certainly that part of the body could start necrosing, which means undergoing cell death and dying, and it just basically spreads. And I've seen that in patients who, let's say they refuse to have an amputation for whatever reasons, that necrosis or that cell death can just creep up more proximally and more up towards the upper parts of the body. And instead of just losing your toes, let's say you take care of the situation just by doing the toe amputations, well, now you have to do a amputation above the ankle or above the knee or below the knee amputation. So very serious condition. You gotta address it really in an urgent type manner so that this doesn't get any worse.
He told me he wanted to be serious, but this is who he is. I'm glad y'all see who he is. Thank you. You just had to. You ain't no good. You know you ain't no good. But let's get back in the camera.
This is how we.
You ain't no good.
Okay.
You ain't no good.
Yeah. So
look. Wow. That's with me forever. That's with me forever.
I mean, you didn't have no calves to begin with.
I started to get some
implant.
What is it? BBC.
A BBC.
After the fasciotomy incisions are made, generally once the swelling kind of goes down some, patients then require skin grafts to cover that muscle. So it's not like you're opening the muscle and then you're trying to close it back together. No, you leave it open, you cover it with a skin graft. And that's exactly what Deon Sanders had.
Your calf.
While you down there, you might well go hook me up, man.
So what did they tell you? So when the doctor came in, he said,
I saw that look.
And he's telling you, Mr. Sanders.
I saw that look, man. First of all, I had 3 toe surgeries for my playing days,
Right.
and it was bad. So I went to get it checked out again because it was bad. And the lady said, the doctor, she said, your foot been dislocated for like 15 years. I said, how's that possible? They say, I'm pretty sure you've been feeling pain. I said, yeah, but we football players.
Right.
That's how we play through that. I dealt with 15 years. And she said, you're going to have surgery. I said, okay. How long am I out? She said, you're going to have to. I said, no, I'll be back to practice tomorrow. I can't do that.
Right.
Just give me a knee scooter, I'm straight. I went right back to practice the next day. Mm-hmm. And as the week, I think 2 weeks went by, and they changed my bandage every morning, and my head trainer saw my first 2 toes was black. She said, oh, coach, we got to go to the doctor right now. This is not normal. I said, we're going to practice first. Then we're going to go to the doctor.
That's from the lack of blood supply. But the toes, they turn black, and that's a sign of cell death or necrosis, that toe is not getting enough blood flow. So something needs to be done, or also what needs to happen is you need to figure out why did that toe not get blood supply. And that's probably the reason why they led to the investigation and, hey, you have blood clots that led to the lack of blood flow, or what we call ischemia to that toe.
And we went to the doctor. You know when you see that look?
Yeah.
And they said, we got to have surgery right now.
Right.
I said, so what's wrong? We got to have surgery right now.
Okay. Well, what's wrong?
Yeah. So it was, we got to have surgery right now. Have anybody in your family had blood clots? I said, I don't know. So we called my mama. And you know my mama. My mama said, yeah, baby, by the way, your uncle died from blood clots a few years back, and your other uncle almost died last year from blood clots, and I just got diagnosed with blood clot. I said, thank you, Mom, I sure appreciate it.
So that's the genetic or the family history that is very important, especially when people are having surgeries. We always ask patients, do you have a family history of blood clots? Maybe that would have changed something in the management of this patient, of Deon Sanders, placing him on a blood thinner right after surgery to prevent blood clots. So he got the blood clot because he had surgery and he was high risk, and which led to the ischemia and to his toes turning dark and him losing his toes, and also the compartment syndrome.
Mama had all that info.
Oh, you sitting on it. Just sitting on that thing. Yeah. I'm about to check out and she just sitting on this stuff. So we had 9 surgeries.
Wow.
9 surgeries and 8 within a month. And I think I had another one after that.
So all that.
All that. And my son, you know, Shador was coming every day. Shiloh was coming. But Shador came and said, Dad, I need you. You gotta understand, he had never played a game without me in his life.
Right.
Except for those. And I'm looking at the game, looking at his passing completion percentage, just slowly going down.
Right.
From 74, 72, 70, 68. He said, Daddy, I need you. I said, I'll be there. So that's the time we played, I think we played Southern. And I got in the chair. It was freezing cold. I was frail. You know, I lost about 30 pounds.
Right.
I went through the game. And he brought us back that night. Then Shiloh had the game clinching interception.
Right.
And it was 21 points on the scoreboard. I was like, God, look at you. 21 points on the scoreboard. Shador made a game-winning touchdown pass and Shiloh clinched it. I said, God, look at you.
I guess they didn't remember you did all that at Jackson State. But now we move it on. We move it on.
Crazy story. These blood clots can be very serious, especially if you have surgery, if you have risk factors, if you're a smoker, if you're overweight, if you're diabetic, if you take oral contraceptives, all those things place you at risk for having a blood clot, especially if you have a genetic predisposition. So Deon Sanders, he lost his toes. He had surgery to try to correct a turf toe, ended up getting a blood clot, which led to ischemia or lack of blood flow to his toes, which led to compartment syndrome and him losing 2 toes. So crazy situation. He almost lost his life. He said he lost like 40 pounds in his whole ordeal, but I'm glad that you know, he's better now, he's stable. You know, I would rather lose my toes than my life. So this is Dr. Webb. Thank you for watching. I hope you enjoyed this video. Make sure you subscribe, and we'll see you on the next one.